Hello, future nurses, and welcome back. You've officially reached Practice Test 17 in our 30-day NCLEX challenge. Can you believe we're more than halfway there? Today, we're diving into another full-length exam packed with the high-yield, must-know questions that consistently appear on your NCLEX. But before we jump into this next set of questions, I have an exclusive offer just for you. We're giving you a 5-day free trial of our complete NCLEX crash course. No credit card, no catch. Here's what you'll unlock instantly when you click the WhatsApp link in the description and type Hi. Live and recorded NCLEX lectures to fit your schedule. Next Gen. NCLEX, NGN, case study questions to master the latest format. 5,000 previously asked NCLEX questions for unbeatable practice. Customizable 1-week and 1-month study planners to keep you on track. Comprehensive PDF notes and expert guidance every step of the way. All this completely free for 5 days, because your success is our mission. So go ahead, click that link, send Hi, and we'll handle the rest. All right, let's power up for Practice Test 17 and get one step closer to NCLEX success. To set the stage, start with question 1. A nurse is continuously monitoring a laboring client's fetal heart rate and notices a deceleration that begins after the peak of a uterine contraction and does not return to baseline until after the contraction has ended. Here are the options. A. Variable deceleration. B. Late deceleration. C. Early deceleration. D. Normal variability pattern. The correct answer is B. Late deceleration. This pattern is most consistent with uteroplacental insufficiency because late decelerations are characterized by a gradual, symmetric fall in fetal heart rate that begins after the contraction reaches its peak and recovers only once the contraction has ended. In this tracing, the gradual onset and recovery occurring after the contraction's peak signify decreased fetal perfusion. Immediate interventions should include repositioning the mother to her left lateral side, administering supplemental oxygen, and providing an intravenous bolus of isotonic fluids to improve uterine blood flow. Shifting focus to gastrointestinal risk factors. With question number 2, imagine you're counseling clients about conditions that predispose to gastric cancer. And you ask, which of the following should the nurse recognize as a predisposing condition? Irritable bowel syndrome, duodenal ulcer, chronic gastritis, or sickle cell anemia? Here are the options. A. Irritable bowel syndrome. B. Duodenal ulcer. C. Chronic gastritis. And D. Sickle cell anemia. The correct answer is C. Chronic gastritis. Chronic gastritis, especially the atrophic type, serves as a well-established precursor to gastric adenocarcinoma because persistent inflammation of the gastric mucosa leads to atrophy, intestinal metaplasia, dysplasia, and ultimately malignant transformation. Chronic gastritis damages the gastric lining over time, fostering these stepwise cellular changes. So, eradication of Helicobacter pylori and monitoring for metaplastic changes are key preventive strategies. Question 3. Moving now to occupational health. Imagine you're teaching staff strategies to reduce work-related back injuries, and you ask, which area of the spine is most frequently injured in workplace incidents? The cervical spine, the lumbar spine, the thoracic spine, or the pelvis? Here are the options. A. Cervical spine. B. Lumbar spine. C. Thoracic spine. And D. Pelvis. The correct answer is B. Lumbar spine, because this region bears the majority of the upper body's weight and endures the greatest mechanical stress during lifting, bending, and twisting. In fact, the 5 vertebrae of the lumbar spine support trunk flexion, extension, and rotation under load, so repetitive strain, improper lifting mechanics, or sudden heavy loads predispose this area to muscle strains, ligament sprains, and intervertebral disc injuries. In contrast, the cervical spine, while mobile and susceptible to strain in desk workers, does not bear as much axial load. The thoracic spine is stabilized by the rib cage, limiting its range of motion and injury risk. And the pelvis, though affected by heavy lifting, is less commonly the site of occupational back injuries than the lumbar vertebrae and associated soft tissues. Question 4. Next, shifting focus to pharmacologic management. Picture a client diagnosed with generalized anxiety disorder and ask, which medication should you expect to be prescribed? Haloperidol, fluphenazine, buspirone, or methylphenidate? The options are A. Haloperidol, B. Fluphenazine, C. Buspirone, and D. Methylphenidate. The correct answer is C. Buspirone, because as a non-benzodiazepine anxiolytic, it enhances serotonin activity to reduce excessive worry and tension without causing sedation, dependence, or withdrawal. Buspirone's anxiolytic effect develops gradually over 2 to 4 weeks, so clients must take it consistently and understand that immediate relief may not occur. By contrast, haloperidol and fluphenazine are first-generation antipsychotics with no established role in treating anxiety and carry risks of extrapyramidal side effects. And methylphenidate is a stimulant for attention deficit hyperactivity disorder that can actually exacerbate anxiety symptoms. Question 5. Finally, turning attention to infection control, imagine you're on a long-term care facilities committee during a norovirus outbreak, and you ask, which action should you recommend to minimize further spread? Require all clients to wear surgical masks. Replace clean gloves with sterile gloves. Reinforce hand hygiene with dietary staff, or screen visitors for respiratory symptoms? The options are A. Masks, B. Sterile gloves, C. Hand hygiene reinforcement, and D. Respiratory screening. The correct answer is C. Reinforce hand hygiene protocols with dietary and food service staff, because norovirus is transmitted via the fecal-oral route, often through contaminated food or surfaces. And proper hand washing with soap and water removes viral particles more effectively than alcohol-based sanitizers. Surgical masks and visitor respiratory screening target droplet transmission and cough-related pathogens rather than a virus spread by ingestion. And sterile gloves are reserved for invasive procedures, whereas clean gloves change between tests combined with rigorous hand hygiene will dramatically reduce new cases. Question 6. Turning to postpartum care, a nurse is prioritizing which client is at highest risk for postpartum hemorrhage. The options are A. A client with uterine atony who required forceps-assisted delivery, B. A client experiencing urinary incontinence and diuresis, C. A client with an active genital herpes outbreak who underwent a cesarean section, or D. A client with gestational diabetes who has elevated blood glucose postpartum. The correct answer is A. A client with uterine atony who required forceps-assisted delivery, because uterine atony, failure of the uterus to contract effectively after birth, is the leading cause of postpartum hemorrhage. And instrument-assisted delivery further increases bleeding risk through soft tissue trauma and muscle fatigue. In contrast, transient urinary incontinence and diuresis are normal postpartum adaptations. An active herpes outbreak does not exacerbate bleeding beyond the baseline cesarean risk, and hyperglycemia alone does not directly precipitate hemorrhage without evidence of macrosomia or uterine atony. Early recognition of risk factors, such as prolonged labor or chorioamnionitis, allows preparation of uterotonics and blood products at the bedside to manage excessive blood loss. Question 7. Moving on to acute care prioritization, a nurse on a medical surgical unit must decide which client requires immediate attention. The choices are A. A client with a blood glucose of 250 milligrams per deciliter requesting insulin, B. A client post-thyroidectomy who has a hoarse voice and difficulty speaking, C. A client with pneumonia reporting shortness of breath after ambulating, or D. A client post-cholecystectomy rating pain as 7 out of 10. The correct answer is B. The post-thyroidectomy client with hoarseness and vocal difficulty, because these signs may indicate recurrent laryngeal nerve injury or an expanding neck hematoma threatening airway patency, an immediate life-threatening emergency. By comparison, hyperglycemia in a stable client can be managed after securing the airway. Exertional dyspnea in pneumonia is expected and less urgent, and severe pain, while important, does not supersede a potential airway compromise. Hold up! Before we tackle the next question, imagine accelerating your NCLEX prep with a proven system that's already helped over 100,000 nurses succeed. Claim your free 5-day trial of our complete NCLEX crash course and gain access to live interactive lectures, on-demand recordings, NGN case simulations, 5,000 real exam questions, plus customizable 1-week and 1-month study roadmaps and expert PDF notes. Simply tap the WhatsApp link in the description, type "Hi," and our team will enroll you instantly. Don't let this chance slip away. Now, let's move on to question 20. Question 8. Next, in caring for a client on bed rest after spinal cord injury, you're asked which foot position best prevents foot drop. The options include A. Supination, B. Dorsiflexion, C. Hyperextension, and D. Abduction? The answer is B. Dorsiflexion, because maintaining the ankle in a neutral, upward flexed position counteracts the plantar flexion tendency that leads to contractures and foot drop. Supination merely turns the sole inward, hyperextension risks ligament damage, and abduction moves the limb laterally, without affecting ankle dorsiflexion. In addition to proper positioning, regular passive and active range of motion exercises and use of footboards or ankle foot orthoses support long-term prevention of contractures. Question 9. Finally, in pediatric consent scenarios, a 12-year-old awaiting appendectomy has consent signed by her mother when her father, who shares joint legal custody, arrives at the last moment. The nurse must decide: A. Ask the father to complete a second consent. B. Cancel the surgery until both parents consent. C. Proceed with surgery as scheduled. Or D. Inform the surgeon of the father's arrival. The correct response is C. Proceed with surgery as scheduled. Because when divorced parents have joint legal custody, the signature of either parent is legally valid for medically necessary procedures. Delaying treatment to obtain another signature risks progression to perforation and peritonitis. Requiring a second consent or canceling the operation is legally unnecessary and clinically harmful. And while informing the surgeon is courteous, it should not delay emergent care. Always verify custody status. But in urgent situations, the custodial parent's valid consent authorizes immediate intervention. Question 10. Shifting focus to skin and tube site assessments. While bathing a client, the unlicensed assistive personnel reports foul-smelling drainage from the gastrostomy site. The options include A. Collect a specimen for culture, B. Inspect the tube site and drainage characteristics, C. Apply a sterile dressing around the tube, or D. Take the client's temperature. The correct answer is B. Inspect the tube site and drainage characteristics, because initial validation through direct assessment is essential to determine whether the issue reflects infection, mechanical leakage, or tube displacement. By carefully noting the color, consistency, odor, and amount of drainage, the nurse gathers the information needed to decide whether to culture the drainage, change the dressing, or escalate care. Collecting a specimen before this focused assessment risks invalid results. Changing the dressing prematurely could conceal signs such as erythema or swelling, and measuring temperature before inspecting the site may delay recognition of a local problem. Documenting the findings, including the time noted and any accompanying redness or induration, and then promptly notifying the provider if infection is suspected are crucial next steps. Question 11. Turning to anticoagulation management, a new nurse states, "We can stop the heparin infusion once the INR hits 4.0. Which response indicates a need for further teaching? The options are A. Stopping at an INR of 4 could leave us above the therapeutic range for venous thromboembolism. B. Protamine sulfate should be on hand if the APTT climbs too high. C. Hypotension and tachycardia may signal internal bleeding. And D. Both heparin and warfarin increase bleeding risk. The response warranting follow-up is A, because therapeutic warfarin anticoagulation for VTE targets an INR between 2.0 and 3.0. Discontinuing heparin at an INR of 4.0 places the client at undue bleeding risk without specific provider direction. By contrast, B is correct since protamine sulfate is the antidote for heparin. C accurately identifies hypotension and tachycardia as early signs of bleeding. And D is true because both medications inhibit clot formation, heightening bleeding risk. Question 12. Now consider a client with congestive heart failure. Which auscultatory finding is most characteristic? A. Intermittent claudication. B. An S3 gallop. C. Venous stasis ulcers. Or D. Widened pulse pressure? The hallmark finding is B. The S3 gallop, because this extra low-frequency lub-dub-taw sound heard at the apex with the client in left lateral decubitus reflects rapid ventricular filling against a stiff ventricle, an unmistakable sign of systolic dysfunction and volume overload. In contrast, A describes peripheral arterial disease, calf pain, C refers to venous ulceration from chronic venous insufficiency, and D more often indicates conditions like aortic regurgitation rather than left-sided heart failure. Question 13. Finally, when positioning a 9-year-old boy for a lumbar puncture to evaluate acute myeloid leukemia involvement, which posture is optimal for accurate needle placement? And opening pressure measurement, A. Prone, B. Trendelenburg, C. Supine, or D. Lateral decubitus? The correct choice is D. Lateral decubitus, because flexing the hips and knees toward the chest opens the vertebral spaces at L3, L4, or L4, L5 and allows reliable manometry readings on a level plane. By comparison, A. Prone is reserved for radiologically guided punctures, B. Trendelenburg is used for central line placement or hypotension, and C. Supine prevents adequate spinal flexion and is only used after the procedure is complete. Question 14. Turning to antiviral therapy in pediatrics, imagine an immunocompromised child hospitalized with a new varicella rash and ask, which prescription should you anticipate? Amoxicillin, clavulanate, acyclovir, doxycycline, or azithromycin? The options are A. Amoxicillin clavulanate, B. Acyclovir, C. Doxycycline, and D. Azithromycin. The correct answer is B. Acyclovir, because in high-risk hosts, varicella zoster virus can disseminate to the lungs or brain. An early initiation of intravenous or high-dose oral acyclovir inhibits viral DNA polymerase, reducing lesion formation and viral shedding. In contrast, choices A, C, and D are antibacterial agents with no activity against viruses and therefore would not address the underlying infection. To maximize efficacy, begin acyclovir within 24 hours of rash onset and maintain airborne and contact precautions until all lesions crust. Question 15. Next. Shifting immediately to post-operative monitoring, consider an 88-year-old client who returned from total hip arthroplasty just 15 minutes ago. Should you first assess range of motion of the new hip, measure urine output, inspect the surgical incision, or take vital signs? The answer is taking vital signs, because hemodynamic stability is the primary concern after anesthesia. Tachycardia or hypotension may signal bleeding, hypovolemia, or anesthetic complications requiring prompt intervention, whereas range of motion exercises are contraindicated until stability is confirmed. Urine output monitoring follows once basic stability is ensured. An incision inspection, while important, lags behind vital signs in urgency. Obtain vital signs every 5 minutes in the immediate postoperative phase to catch any deviations early. Pause for a moment. Your NCLEX breakthrough is waiting. Join more than 100,000 successful graduates by starting your free 5-day trial of our complete NCLEX crash course today. You'll get live and recorded classes, next-gen NCLEX case studies, 5,000 past exam questions, targeted 1-week and 1-month study plans, plus in-depth PDF notes with expert tips. Just click the WhatsApp link below, send "Hi," and you're in. Ready to elevate your prep? All right, let's proceed to the next question. To begin with, question 16 asks, a client presents with a noticeable droop of the left upper eyelid. How should the nurse record this observation? Here are the options. A. Mydriasis, B. Ptosis, C. Presbyopia, D. Hyphema. The correct answer is B. Ptosis. Ptosis denotes eyelid sagging and may be congenital or acquired, often seen in neurological disorders such as myasthenia gravis or multiple sclerosis, whereas mydriasis refers to pupil dilation, presbyopia to age-related farsightedness, and hyphema to bleeding in the anterior chamber of the eye. Next, question 17 states, a client's serum potassium level is 3.1 milliequivalents per liter, with the normal range being 3.5 to 5.0 milliequivalents per liter. The provider orders 40 milliequivalents of potassium chloride to be administered intravenously over 4 hours. Which finding would indicate that the treatment has been effective? The choices are A. Bowel sounds are normal, B. Flattened T waves on the electrocardiogram, C. Diminished deep tendon reflexes, D. Persistent muscle cramps. Option A is correct, because restoration of normal bowel sounds signifies return of adequate gastrointestinal motility, whereas flattened T waves, decreased reflexes, and muscle cramping all reflect ongoing hypokalemia. Moving on, question 18 reads, the provider prescribes 400,000 units of penicillin G-benzathine. The vial label indicates 300,000 units per 10 milliliters. How many milliliters should the nurse draw up? Round your answer to the nearest whole milliliter, using the dose ordered over dose on hand formula. You divide 400,000 by 300,000 to get approximately 1.33, multiply by 10 milliliters to get 13.3 milliliters, and then round to 13 milliliters. Thus, the nurse should administer 13 milliliters. Finally, question 19 poses: when admitting a client with Guillain-Barre syndrome to the intensive care unit, which piece of equipment must be immediately accessible at the bedside? The options are A. Blood pressure cuff, B. Pulse oximeter, C. Oral intubation kit, D. Arterial blood gas supplies. The correct answer is C. The oral intubation kit, because Guillain-Barre syndrome can progress to involve the diaphragm and compromise respiratory function, making rapid airway management essential. Whereas the other items, while useful, are not as critical in an acute ascending paralysis scenario. Question 20. Moving on to delegation decisions on the medical unit, you review 4 pending tasks and ask which assignment is appropriate to delegate to unlicensed assistive personnel. Perform sterile dressing changes for a post-surgical client, assist an ambulatory client with one-person help to the restroom, manage continuous nasogastric tube feedings, or collect multiple urine specimens from an indwelling catheter. The options are A. Sterile dressings, B. Restroom assistance, C. NG feedings, and D. Urine specimens. The correct answer is B. Assisting the ambulatory client to the restroom, because safe transfers of stable clients with one-person assistance fall squarely within UAP scope and do not require nursing judgment or sterile technique. By contrast, sterile dressing changes, enteral feeding management, and sterile specimen collection demand assessment, aseptic skill, and professional licensure. Question 21. Then, focusing on chest tube complications. A client with a pneumothorax reports a crackling Rice Krispies sensation under the skin near the insertion site. Should you document the finding as expected, clamp the chest tube, notify the primary healthcare provider, or apply nasal cannula oxygen? The options are A. Document, B. Clamp, C. Notify, and D. Oxygen. The immediate action is C. Notify the provider, because subcutaneous emphysema indicates air leaking into tissues, a complication that may require suction adjustment or system replacement. Documenting without action risks deterioration. Clamping can worsen the pneumothorax, and oxygen does nothing to address the trapped air in the subcutaneous space. Question 22. Finally, in the medication administration sequence, a client is scheduled to receive a new drug. Should the nurse first verify the client's full name and date of birth, ask about allergies, review the latest vital signs, or check for potential drug interactions? The options are A. Identification, B. Allergies, C. Vitals, and D. Interactions. The foundational step is A. Verifying 2 unique identifiers, because ensuring you have the right patient prevents wrong person errors before any further checks. Allergy assessment, vital sign review, and drug interaction screening all follow once correct identification is confirmed. To begin with, question 23, a client is scheduled to receive continuous epidural analgesia for post-operative pain control, and the nurse must anticipate which pre-procedure medication to administer. Here are the options. Option A is lactated Ringer's solution, option B is ondansetron, option C is ketorolac, and option D is haloperidol. The correct answer is option A, lactated Ringer's solution. Preloading with an isotonic crystalloid such as a liter of lactated Ringer's is standard practice before initiating epidural analgesia because the sympathetic blockade can cause vasodilation and hypotension. Administering the fluid bolus 15 to 30 minutes before placement increases intravascular volume and helps maintain hemodynamic stability. Ondansetron, option B, may relieve nausea after neuraxial anesthesia but is not given routinely before every epidural. Ketorolac, option C, is useful for multimodal pain management but not immediately before catheter placement. And haloperidol, option D, has no role in epidural preparation and could introduce unnecessary side effects. Moving on to question 24, a client has been taught to use a transcutaneous electrical nerve stimulation unit and must demonstrate understanding of proper use. The options are, option A, I should not take any pain medication while the electrodes are applied. Option B, I will increase the current until I feel a mild tingling or pins and needles. Option C, I'll place the electrodes all over my body for best results. And option D, I should feel my muscles twitch strongly when the unit is on. The correct answer is option B, I will increase the current until I feel a mild tingling or pins and needles. Proper application involves adjusting intensity to a comfortable sensory level that stimulates large diameter nerve fibers to block pain transmission without causing discomfort or muscle contractions. Concurrent pain medications are not contraindicated. Option A, electrodes should be placed around the painful site rather than randomly over the body. Option C, invisible muscle twitching. Option D indicates excessive intensity and may lead to muscle fatigue rather than effective pain relief. Following that, question 25 asks the nurse to calculate a client's total fluid intake given a 0.9% saline infusion at 125 milliliters per hour for 6 hours. 3 8-ounce cups of cranberry juice, 1 8-ounce cup of coffee, and 1 8-ounce cup of water. Converting all fluids to milliliters, 125 milliliters per hour times 6 hours equals 750 milliliters for the infusion. 3 cups of juice at 240 milliliters, each equals 720 milliliters. 1 cup of coffee is 240 milliliters, and 1 cup of water is 240 milliliters. Yields a total intake of 1,950 milliliters. Remember that 1 ounce equals 30 milliliters, and 1 cup equals 8 ounces. Include all oral liquids at room temperature, and count ice chips as half volume in intake records. Before we dive into the next question, imagine unlocking your NCLEX success in just 5 days. Join over 100,000 nurses who have already triumphed with our complete NCLEX crash course. Right now, you can start a free 5-day trial featuring live and recorded lectures, next-gen NCLEX case studies, 5,000 practice questions from past exams, customizable 1-week and 1-month study planners, and comprehensive PDF notes with expert guidance. Simply head to the description box, tap the WhatsApp link, and message us hi to enroll instantly. Don't let your peers pull ahead. Secure your advantage today. Now, let's tackle the next question. Subsequently, question 26 presents a client with multiple sclerosis experiencing significant muscle spasticity. Which medication should the nurse expect to be prescribed? Option A is topiramate. Option B is risperidone. Option C is prazosin. And option D is baclofen. The correct answer is option D, baclofen. As a gamma-aminobutyric acid agonist acting at the spinal level, baclofen reduces muscle tone and spasms, improving functional mobility and comfort in multiple sclerosis. Topiramate, option A, is an anticonvulsant for seizures and migraine prophylaxis. Risperidone, option B, is an antipsychotic. And prazosin, option C, is an alpha blocker used for hypertension and post-traumatic stress disorder nightmares. Clinical pearls include starting baclofen at 5 milligrams 3 times daily and titrating slowly to minimize drowsiness, dizziness, and hypotonia. Turning our attention to question 27, on a hospital security committee addressing infant abduction, which recommendation should the nurse propose? Option A is to rearrange rooms so that cribs are positioned near exit doors. Option B is to instruct staff to carry infants in hallways rather than using bassinets. Option C is to issue staff identification badges without photographs for privacy. And option D is to photograph every visitor entering the unit. The correct answer is option D, photograph every visitor entering the unit. A visitor photograph log provides an immediate reference to verify identities and track movements, enhancing the ability to detect and respond to unauthorized individuals in high-risk areas such as maternity and the neonatal intensive care unit. Placing cribs near exits, option A, actually increases risk. Carrying infants in hallways, option B, circumvents secure transport protocols. And badges without photos, option C, cannot confirm identity at a glance. Best practice combines visitor photography with badge access systems, unit-specific security codes, and periodic lockdown drills. Let's progress to question 28, in which a nurse is identifying risk factors for placenta previa during prenatal assessment. The options are option A, maternal cocaine use, option B, polycystic ovary syndrome, option C, nulliparity, and option D, gestational diabetes. The correct answer is option A, maternal cocaine use. Cocaine's vasoconstrictive effects damage uterine blood vessels and increase the likelihood of low placental implantation over the cervical OS. Polycystic ovary syndrome, option B, is linked to gestational diabetes and hypertension but not placental placement. Nulliparity, option C, is more associated with preeclampsia. And gestational diabetes, option D, raises concerns for macrosomia and hypertensive disorders, but does not affect implantation site. Other important risk factors include prior cesarean delivery, uterine surgery, multiple gestation, and smoking. Early ultrasound identification of low-lying placentas guides management to prevent hemorrhagic complications. Next up, question 29 describes a client receiving chemotherapy who expresses interest in complementary therapies a friend used to beat cancer. Which response by the nurse best facilitates therapeutic dialogue? Option A is complementary therapies aren't safe alongside chemotherapy. Option B is tell me more about what therapies your friend used. Option C is have you discussed this idea with your family? And option D is tell me more about what you mean by complementary therapies. The correct answer is option D. Tell me more about what you mean by complementary therapies. Clarifying the client's own definition allows the nurse to uncover specific practices, assess for potential interactions, and partner with the client and oncology team to develop a safe, evidence-informed plan. Asking about the friend's experience, option B, shifts focus away from the client's values. Declaring therapies unsafe, option A, may shut down dialogue and is not accurate for all modalities. And immediately involving family, option C, presumes readiness rather than centering the client's perspective. After clarification, document any complementary therapies and collaborate with the team to integrate safe practices. Continuing on with question 30, a client newly diagnosed with syphilis asks, does everyone need to know? Which response by the nurse is most therapeutic? Option A is, we are required to report syphilis to the health department, and they will notify your partners. Option B is, HIPAA prevents me from sharing your diagnosis without your consent. Option C is, you should let your past partners know so they can be tested and treated. And option D is, I understand this is distressing. I'm here to support you. Would you like to talk about how you're feeling? The correct answer is option D. I understand this is distressing. I'm here to support you. Would you like to talk about how you're feeling? This empathetic response prioritizes the client's emotional needs and uses reflective listening to create a safe environment for processing the news before discussing public health procedures or partner notification. Leading with mandatory reporting, option A, can feel impersonal. Misstating confidentiality laws, option B, is misleading. And urging partner notification, option C, may feel pressuring before addressing emotional readiness. Once the client feels supported, the nurse can provide information about reporting requirements, treatment, and confidential partner notification strategies. Lastly, question 31 involves documenting a pregnant client's gravidity, term births, preterm births, abortions, and living children based on an obstetric history of twins born at 31 weeks, a stillbirth at 23 weeks, and a spontaneous abortion at 12 weeks, with the current pregnancy at 25 weeks. The options are option A, G4T0P2A1L2, option B, G4T0P1A2L2, option C, G4T0P1A2L3, and option D, G4T1P1A1L2. The correct answer is option A, G4T0P2A1L2. There have been 4 pregnancies in total, 0 term births, 2 preterm births, the twins at 31 weeks and the stillbirth at 23 weeks, 1 abortion or miscarriage at 12 weeks, and 2 living children, the surviving twins. Remember that multiple births count as 1 pregnancy for gravidity and preterm classification, but their survivors count individually for living children. Stillbirths before 20 weeks count as abortions, and those after 20 weeks count as preterm or term based on gestational age. Question 32. To begin, a client recovering from a hematopoietic stem cell transplant requires prophylaxis against bacterial infections. The nurse should consider one of 4 medications: A, desmopressin, B, montelukast, C, zidovudine, or D, azithromycin, and the correct choice is D, azithromycin. After transplant, profound immunosuppression places clients at high risk for pneumonia from encapsulated or atypical organisms. Azithromycin's excellent pulmonary penetration, long half-life for once daily dosing, and anti-inflammatory effects make it ideal. Desmopressin treats central diabetes, insipidus or bleeding disorders, montelukast targets asthma prophylaxis, and zidovudine is an antiretroviral, none of which address post-transplant bacterial coverage. In practice, azithromycin is often combined with trimethoprim sulfamethoxazole for pneumocystis jirovecii prophylaxis fluoroquinolones for neutropenic fever, and tailored antifungal or antiviral agents per protocol. Question 33. Next, consider a child with a tibial fracture and a history of a recent radius and clavicle fracture. Among the options, A. Neglect, B. Psychological abuse, C. Physical abuse, or D. Osteosarcoma. The most concerning is C. Physical abuse. Multiple fractures at different healing stages and at protected sites strongly suggest non-accidental trauma, prompting immediate multidisciplinary evaluation and mandated reporting. Neglect refers to unmet basic needs and rarely causes fractures. Psychological abuse produces emotional harm without physical injury, and osteosarcoma typically presents with localized pain, swelling, and systemic signs rather than multiple healing fractures. Question 34. Moreover, when a client in severe ulcerative colitis flare exhibits a serum osmolality above 295 milliosmoles per kilogram and urine-specific gravity over 1.020, the nurse must distinguish among A. Renal insufficiency, B. Diabetes insipidus, C. Hypoaldosteronism, and D. Deficient fluid volume. The correct answer is D. Deficient fluid volume, because profuse diarrhea depletes water and electrolytes, concentrating both blood and urine. Renal insufficiency impairs urine concentration. Diabetes insipidus leads to dilute urine despite hypertonic serum, and hypoaldosteronism causes sodium wasting without the marked urine concentration seen here. Question 35. Following that, a mechanically ventilated client receiving continuous fentanyl and midazolam infusions demonstrates one of these signs. A. Constricted pupils, B. Hypertension, C. Coarse tremors, or D. Diarrhea. Pinpoint pupils, option A, are the hallmark of opioid toxicity. Respiratory depression may be masked by the ventilator, making meiosis the most reliable indicator. Hypertension is atypical. Opioids usually cause hypotension. Tremors suggest withdrawal or stimulant use, and diarrhea contradicts opioids' constipating effect. Hold that thought. Here's a game changer for your NCLEX prep. More than 100,000 nurses have aced their boards with our all-in-one NCLEX crash course, and you can too. For a limited time, claim your free 5-day trial loaded with live and on-demand classes, next-gen NCLEX simulations, 5,000 real exam questions, plus personalized study schedules, and downloadable PDF notes. Tap the WhatsApp link in the description, say hi, and you're in. Your future self will thank you. Now, back to the next question. Question 36. In another scenario at ED triage, the nurse evaluates 4 clients. A client requesting tuberculosis screening after domestic travel, a client needing a routine diabetic foot ulcer dressing change, a pregnant client with fever and a generalized vesicular rash, and a client concerned about HIV exposure. The immediate priority is the pregnant client with fever and diffuse vesicular rash, option C, suspicious for active varicella, which requires airborne and contact isolation to protect mother, fetus, and others. Tuberculosis. Screening after U.S. travel poses little acute risk. Routine wound care without known MDRO is low priority. And HIV exposure concerns prompt evaluation but not urgent isolation. Question 37. Shifting focus to ethics, a nurse volunteers to stay beyond scheduled hours to help the next shift manage a heavy load. Which principle is best illustrated? A. Non-maleficence, B. Paternalism, C. Beneficence, or D. Veracity. The correct answer is C. Beneficence, since the nurse's proactive service promotes patient welfare and supports colleagues. Non-maleficence pertains to do no harm without proactive good deeds. Paternalism overrides autonomy for perceived good, and veracity concerns truthfulness rather than volunteering. Question 38. Finally, a pregnant client with cardiac disease and active labor should receive appropriate monitoring and support. Of these interventions, A. Continuous maternal ECG and external fetal monitoring, B. Early effective analgesia to minimize pain-induced tachycardia, C. Coaching paced, light bearing down efforts in the second stage, or D. Encouraging frequent ambulation between contractions. The one not recommended is D. Encouraging frequent ambulation. Walking increases myocardial oxygen demand and risks tachycardia or ischemia, whereas continuous monitoring, A. Early analgesia, B. And coached, gentle pushing, C. Help maintain hemodynamic stability in heart-diseased clients. Question 39. First, When 4 newly admitted clients each have a first dose medication order, the nurse must decide which to carry out immediately. A. Subcutaneous apoetin alpha to correct chronic anemia. B. Oral oxycodone for moderate to severe pain at 7 out of 10. C. Begin an intravenous crystalloid bolus for suspected septic shock. Or D. Intramuscular hydroxyzine for acute anxiety. The correct answer is C. Begin an intravenous crystalloid bolus, because timely fluid resuscitation in sepsis restores circulating volume, improves tissue perfusion, and reduces mortality. A rapid infusion of 20 milliliters per kilogram of crystalloid is the cornerstone of immediate management. Apoetin alpha works over weeks to enhance erythropoiesis and does not address acute physiology. Pain management, while important, must follow hemodynamic stabilization, and anxiety control cannot supersede the need for emergent circulatory support. Question 40. Next, a client at 30 weeks gestation is experiencing regular, painful uterine contractions with cervical change, placing her at risk for preterm birth. The provider may prescribe one of the following to halt uterine activity: A. Penicillin G, B. Nifedipine, C. Oxytocin, or D. Misoprostol. The correct answer is B. Nifedipine, because as a calcium channel blocker, it inhibits calcium influx into uterine smooth muscle, reducing contraction frequency and intensity, and is widely used as a tocolytic to delay delivery long enough, typically at least 48 hours, to administer corticosteroids for fetal lung maturation. Penicillin G prevents group B streptococcal transmission, or treats syphilis, but does not suppress contractions. Oxytocin and misoprostol both stimulate uterine activity and would exacerbate preterm labor. In addition to nifedipine, the nurse should anticipate magnesium sulfate for fetal neuroprotection, corticosteroids, such as betamethasone to accelerate lung maturity, and close monitoring of maternal blood pressure for hypotension or headache. Question 41. Then, 2 days after chest tube placement for a spontaneous pneumothorax, the nurse assesses which finding best indicates successful lung re-expansion. A. A chest radiograph revealing no residual pneumothorax. B. Bilateral, clear breath sounds on auscultation. C. Vigorous bubbling in the suction chamber. Or D. Palpable crepitus around the insertion site. The correct answer is B. Bilateral, clear breath sounds, because the primary goal of chest tube drainage is to evacuate intrapleural air and restore ventilation. Hearing equal normal vesicular sounds across both lungs provides the first, rapid bedside confirmation of reinflation. Although a follow-up chest radiograph, option A, definitively confirms resolution, auscultation is immediate. Persistent or vigorous suction chamber bubbling, option C, indicates an ongoing air leak rather than resolution. And subcutaneous emphysema, option D, reflects a complication of air tracking under the skin rather than treatment success. As bubbling decreases and the chamber shifts to gentle titling, the nurse must continue correlating physical findings with imaging and ensure suction settings remain appropriate. Question 42. Finally, when a nurse describes the primary goal of completing an incident report, the options are A. Implementing system changes to prevent future incidence errors. B. Aggregating data for trend analysis. C. Alerting other units about the individual mistake. Or D. Informing the involved staff member of the deviation. The correct answer is A. Implementing system changes, because incident reports serve as quality improvement tools that identify latent system vulnerabilities and drive targeted interventions, such as policy revisions, equipment upgrades, or staff education to reduce error recurrence. While retrospective trend analysis, option B, is a secondary benefit, confidentiality prevents broad interdepartmental alerts, option C, and the reports are not punitive mechanisms to single out individuals, option D. To foster a just culture, the nurse should encourage open reporting, regularly review aggregated data in safety huddles, and track the effectiveness of implemented changes. Question 43. To begin, a 7-year-old postoperative child refuses to walk in the hallway as ordered, and the nurse considers 4 strategies. A. Would you rather walk in the hallway at 9 o'clock or after lunch at 1? B. It's time for your walk now. Let's go. C. I'll call the child psychologist to help with this. Or D. If you walk down the hall, you can have ice cream afterward. The correct answer is A, because offering limited, age-appropriate choices empowers the child, fosters cooperation, and supports autonomy without coercion. By framing ambulation as a decision the child controls, selecting the time, they feel ownership and are more likely to comply. Whereas direct commands can provoke resistance, calling a psychologist is unnecessary for routine mobility, and using food as a bribe undermines intrinsic motivation. Once the time is chosen, the nurse can walk alongside, use encouraging language, and praise the effort immediately to reinforce positive behavior. Question 44. Next, when a client complains of aching and tightness in the left calf, the nurse should detect early thrombophlebitis by A. Gently pressing along the tibial surface for point tenderness. B. Measuring and recording bilateral calf girth each shift. C. Monitoring vital signs every 4 hours for fever. Or D. Observing the client's ability to walk independently. The correct answer is B, because serial circumference measurements objectively quantify localized swelling, the earliest sign of clot formation, allowing subtle increases in limb volume to be identified before pain or gait disturbance occur. Palpating for tenderness may detect pain but cannot track progression. Fever monitoring does not localize limb changes, and gait observation captures late signs rather than early edema. Question 45. Meanwhile, after performing a lumbar puncture on a client suspected of meningitis, the nurse's highest priority is to A. Test for Brodzinski's sign to evaluate meningeal irritation. B. Elevate the head of the bed to 30 degrees for comfort. C. Encourage the client to drink extra clear fluids. Or D. Check the gag reflex before offering oral intake. The correct answer is C, because removal of cerebrospinal fluid can cause intracranial hypotension and post-puncture headache. Prompt oral hydration replenishes cerebrospinal fluid volume, supports hemodynamic stability, and reduces headache severity. Testing for meningeal irritation is part of diagnosis, not post-procedure care. Elevating the head can worsen leakage and headache, and a gag reflex check is unnecessary in a standard procedure under local anesthesia. Wait, before we move on, picture yourself passing the NCLEX on your very first attempt. That's exactly what over 100,000 nurses have done with our complete NCLEX crash course. We're offering you a no-cost 5-day trial that includes interactive live sessions, recorded lectures, NGN case studies, 5,000 previous exam items, plus 1 week and 1 month study plans and expert PDF notes. Just click the WhatsApp link below, type "Hi," and our support team will enroll you in seconds. Ready to join them? All right, let's jump back into the next question. Question 46. Following that, when discovering a 5-year-old lying on the floor of their room after an unwitnessed fall, the nurse's first action is to A. Complete and submit an incident report. B. Help the child return to bed immediately. C. Call for additional assistance. Or D. Perform a head-to-toe assessment for injuries. The correct answer is D, because a systematic physical assessment, including airway, breathing, circulation, and examination of extremities, identifies fractures, head injury, or other urgent issues before any movement or documentation. Additional assistance may be needed after the child's condition is clarified, but initial priority is assessing for hidden trauma. Moving an injured child prematurely can exacerbate injuries, and incident reporting follows stabilization. Question 47. Then, when evaluating a female client with possible syphilis, the nurse looks for A. Painful urination. B. Foul-smelling vaginal discharge. C. A painless genital chancre. Or D. Pain during intercourse. The correct answer is C, because primary syphilis typically presents with a single, firm, indurated, non-tender ulcer at the site of inoculation. This painless chancre is pathognomonic and warrants immediate serologic testing and intramuscular benzathine penicillin. G. dysuria suggests chlamydia or urinary tract infection. Malodorous discharge implies gonorrhea, trichomoniasis, or bacterial vaginosis. And dyspareunia indicates mucosal inflammation from herpes simplex or pelvic inflammatory disease, none of which present with a painless lesion. Question 48. Subsequently, upon receiving a critical serum sodium of 122 milliequivalents per liter, normal range 135 to 145 milliequivalents per liter, the nurse's immediate next step is to A. Contact the primary healthcare provider with the result. B. Initiate seizure precautions at the bedside. C. Read back and verify the value with the laboratory. Or D. Draw a repeat blood sample for confirmation. The correct answer is C, because critical lab values demand read-back verification to ensure the result corresponds to the correct patient and sample before any intervention. Only after confirmation should the nurse notify the provider, implement seizure precautions, or arrange a repeat draw if needed, thereby preventing errors and ensuring appropriate treatment. Question 49. Finally, while setting up an intravenous chemotherapy infusion, the bag tears and spills cytotoxic fluid onto the floor. The nurse must choose among A. Retrieving the chemotherapy spill kit from supply, B. Escorting the client and staff out of the room to a safe area, C. Filing an incident report with risk management, or D. Contacting the pharmacy for cleanup instructions. The correct answer is B, because cytotoxic agents pose immediate hazards through skin contact or inhalation. Removing all individuals from the contaminated zone prevents further exposure. Once everyone is safe, the nurse, or designated staff, can don personal protective equipment, use the specialized spill kit to contain and decontaminate the area per protocol, and then complete incident reporting and consult pharmacy as needed. Question 50. Moving forward, a client with bipolar disorder is acutely manic and repeatedly interrupts other patients' therapy sessions. The nurse considers 4 interventions. A. Assign a staff member to observe the client one-on-one at all times. B. Place the client in seclusion until manic behaviors subside. C. Create a predictable daily routine with clear activities and rest periods. Or D. Encourage participation in large group therapy to channel excess energy. And the best choice is C. Create a predictable daily routine with clear activities and rest periods. Mania often presents with restlessness and impulsivity, so a structured schedule reduces environmental stimuli, fosters a sense of control, and sets clear expectations that minimize agitation and support self-regulation. Continuous one-on-one observation, option A, can feel punitive and is resource-intensive. Seclusion, option B, is reserved only for imminent harm, and large groups, option D, provide excessive stimulation that may further dysregulate the client. Question 51. Additionally, a post-operative client is instructed to use an incentive spirometer every hour. The nurse should recognize that regular use primarily helps prevent A. Deep vein thrombosis, B. Obstructive sleep apnea, C. Atelectasis, leading to hypostatic pneumonia, or D. Aspiration pneumonia. The correct answer is C. Atelectasis, leading to hypostatic pneumonia, because incentive spirometry encourages slow, deep inhalations that reopen collapsed alveoli and promote even air distribution, thereby reducing secretion pooling and pneumonia risk in dependent lung regions. Deep vein thrombosis prevention relies on leg exercises and mobilization. Option A, sleep apnea treatment involves CPAP or weight management. Option B, an aspiration and pneumonia is avoided through swallowing precautions and positioning. Option D. Question 52. Furthermore, a client with a pneumothorax has a water-sealed chest drainage system in place. The nurse must prevent an air leak within the apparatus by choosing among A. Cleaning the insertion site daily with antiseptic solution, B. Positioning the drainage unit below chest level on the floor, C. Encouraging the client to perform incentive spirometry hourly, or D. Checking and tightening every tubing connection securely. The most effective intervention is D. Checking and tightening every tubing connection, because loose or damaged connectors allow outside air into the system, disrupting the one-way valve and impeding lung re-expansion. Although keeping the unit below chest level, option B, promotes drainage and site cleansing, option A, prevents infection, neither stops leaks. Incentive spirometry, option C, aids lung inflation, but does not affect the mechanical integrity of the tubing. Question 53. Subsequently, on post-operative day 1 following a right-hand arthroplasty, the nurse plans care to avoid nerve compression. The options are A. Instructing the client to perform wrist and digit range of motion exercises 10 times per hour. B. Placing personal items within reach of the left, non-operative hand. C. Elevating the right, operative hand on a firm wedge pillow overnight. Or D. Encouraging use of the non-operative hand for light activities. The action to omit is C. Elevating the operative hand on a firm wedge pillow, because firm support can compress nerves at the elbow or wrist and compromise perfusion. Frequent gentle ROM, option A, reduces edema and stiffness. Arranging belongings for the left hand, option B, spares the surgical limb. And relying on the non-operative hand, option D, prevents undue stress on the healing hand. Question 54. Meanwhile, an ICU nurse reviews assigned clients and identifies one situation needing immediate attention. A. A ventilated client in assist control mode with no spontaneous breaths. B. A patient with flail chest reporting pleuritic chest pain on inspiration. C. A chest tube patient who exhibits brief bubbling in the water seal chamber only when coughing. Or D. A client receiving peripheral IV dopamine who complains of burning and pain at the insertion site. The correct answer is D. The client on peripheral dopamine with site pain, because dopamine is a potent vasoconstrictor and can cause severe tissue injury if it infiltrates. The nurse must stop the infusion, aspirate residual drug, elevate the extremity, and inform the provider for antidote administration. Assist control ventilation without spontaneous breaths. Option A is expected. Flail chest pain. Option B warrants analgesia but isn't immediately life-threatening, and transient bubbling during coughing. Option C reflects normal pressure changes rather than an ongoing air leak. Question 55. In this next calculation scenario, a client with sepsis is prescribed azithromycin 500 milligrams intravenously in 250 milliliters of 0.9% saline to infuse over 60 minutes using an administration set that delivers 15 drops per milliliter. To determine the correct drip rate, multiply the total volume by the drop factor. 250 milliliters times 15 drops per milliliter equals 3,750 drops. Next, divide the total drops by the infusion time. 3,750 drops divided by 60 minutes equals 62.5 drops per minute, which rounds to 63 drops per minute. Therefore, setting the infusion pump at 63 drops per minute ensures that the full antibiotic dose is delivered over 1 hour, preventing underdosing or overdosing in this critically ill patient. Quick pause. Your NCLEX journey just got easier. Join the ranks of over 100,000 successful candidates with our complete NCLEX crash course. Get instant access to a free 5-day trial, offering live and recorded classes, next-gen NCLEX case walkthroughs, 5,000 authentic practice questions, structured study planners, and thorough PDF notes. Hit the WhatsApp link in the description, send "Hi," and we'll get you started right away. Don't fall behind. Let's get you across that finish line. Now, on to the next question. Question 56. Then, when preparing a recently deceased client's body for family viewing, the nurse compares 4 actions. A. Raise the head of the bed to 30 degrees before the family arrives. B. Perform oral hygiene to keep the mouth clean. C. Apply lotion to prevent skin dryness. Or D. Remove all identification bands prior to family notification. The most appropriate is A. Raise the head of the bed to 30 degrees, because elevating the head reduces facial lividity from dependent blood pooling, presenting a more natural appearance for grieving loved ones. Oral hygiene, option B, and lotion, option C, are not standard post-mortem steps and may interfere with natural changes, while identification bands, option D, must remain in place until transfer to avoid misidentification. Question 57. Finally, a client's chart notes a positive Murphy's sign during abdominal examination. The examiner applies pressure in one of 4 locations. A. Just below the right costal margin in the mid-clavicular line. B. Just below the left costal margin in the mid-clavicular line. C. 2 inches medial to the right anterior superior iliac spine. Or D. 2 inches medial to the left anterior superior iliac spine. And the correct location is A. Just below the right costal margin at the mid-clavicular line. This spot overlies the gallbladder. A sudden inspiratory arrest, when the diaphragm pushes the inflamed organ against the hand, confirms acute cholecystitis. Option B overlies the spleen and stomach. Option C corresponds to McBurney's point for appendicitis. And option D lies in the left lower quadrant for sigmoid colon issues. Question 58. To start, when preparing to give intramuscular vaccines to a calm but curious 3-year-old, the nurse considers these steps. A. Ask the mother to hold the child's leg steady. B. Explain the procedure to the child using simple words. C. Cleanse the injection site with an alcohol swab. Or D. Administer the injection into the anterolateral thigh. And the first action should be B. Explain the procedure to the child using simple words. Establishing trust and reducing anxiety in a preschooler begins by telling them what to expect, such as, "I'm going to give you a quick pinch like a little dinosaur bite," so that subsequent immobilization, cleansing, and injection happen more smoothly and with less distress. Why A, C, and D is incorrect. Immobilization must follow explanation to avoid startling the child. Antisepsis is essential, but comes after the child understands and consents. Site selection and injection occur only after the child is prepared and positioned. Question 59. Next, a client reports feeling lightheaded and short of breath, and the cardiac monitor shows a steady rhythm at 45 beats per minute with normal P and QRS morphology. The nurse evaluates 4 medications: A. Diltiazem, B. Amiodarone, C. Labetalol, or D. Atropine, and the most appropriate order is D. Atropine. Symptomatic sinus bradycardia, rate less than 60 beats per minute with dizziness and dyspnea, responds to atropine's anticholinergic effect, which blocks vagal tone and increases sinus node firing, thereby improving heart rate and output. Why A, B, and C are incorrect. Diltiazem, amiodarone, and labetalol all slow conduction or reduce contractility and would worsen bradycardia and hypotension. Question 60. Then a client returns from surgery creating a continent ileal reservoir, cock pouch. In the first postoperative hour, the nurse must prioritize these tasks. A. Monitor hourly urine drainage, inspect the stoma for bleeding or ischemia, and check for pouch catheter leaks. B. Meet with family members to explain the surgical outcome. C. Begin teaching stoma hygiene and catheterization techniques. Or D. Perform routine catheter irrigations through the pouch outlet. And the correct choice is A. Monitor hourly urine drainage, inspect the stoma for bleeding or ischemia, and check for pouch catheter leaks, ensuring adequate output, confirming stoma viability, and verifying catheter function immediately safeguards perfusion to the new reservoir and allows prompt detection of complications. Question 61. Following that, 2 days after a right femoral popliteal bypass, a client reports increased pain, and the surgical site shows swelling and bruising. The nurse evaluates these actions. A. Apply firm pressure with a sandbag over the graft incision. B. Check the dorsalis pedis and posterior tibial pulses on that leg. C. Ask if the client has experienced leg cramping when walking. Or D. Place a warm compress over the incision, and should first choose B. Check the dorsalis pedis and posterior tibial pulses. Palpating distal pulses confirms whether arterial flow through the new graft remains patent. Diminished or absent pulses suggest thrombosis or compression and require urgent intervention. In A, applying pressure risks compromising the bypass. Gentle handling is essential. In C, claudication assessment is irrelevant so soon, post-operatively, and unlikely if the graft is functioning. In D, heat can increase bleeding or edema. Vascular assessment precedes comfort measures. Question 62. Moreover, a client 2 days post-gastroduodenostomy has rising blood pressure and heart rate since morning. The nurse considers 4 actions. A. Administer a prescribed antihypertensive agent. B. Evaluate the client's pain level and analgesic effectiveness. C. Inspect the abdominal incision for redness, discharge, or warmth. Or D. Alert the physician about possible internal bleeding and shock. And the next step should be B. Evaluate the client's pain level and analgesic effectiveness. Inadequate pain control triggers a sympathetic response characterized by tachycardia and hypertension. Assessing and addressing pain first prevents inappropriate medication and improves comfort. Why B is correct. Differentiating pain-induced vital sign changes from other causes avoids unnecessary interventions. Why A is incorrect. Treating the numbers without addressing pain may lead to hypotension and masks the underlying issue. Why C is incorrect. Infection signs usually emerge after 72 hours, making incision inspection premature. Why D is incorrect. Hypovolemic shock presents with hypotension, not elevated blood pressure. Current vitals suggest pain response, not bleeding. Question 63. Next, when teaching parents about bicycle safety precautions, the nurse listens for understanding in these statements. See the choices. A. We'll have our child ride facing oncoming traffic so drivers can see them. B. Our child should dismount and walk the bike through busy crosswalks. C. They only need to wear a helmet when passing through congested areas. Or D. It's okay for them to ride barefoot around the block. And correctly recognizes B. Our child should dismount and walk the bike through busy crosswalks. Walking the bike across intersections removes the rider from vehicular traffic, decreasing collision risk. Additional key safety points. Ride with traffic. Cycle in the same direction as cars to improve visibility and predictability. Wear a helmet at all times. Helmets reduce head injury risk on every ride, regardless of distance or location. Use proper footwear. Closed-toe, sturdy shoes protect feet and help maintain pedal control. Question 64. Finally, when evaluating an infant with deeply pigmented skin for jaundice, the nurse must first inspect one of these sites. Choices are A. The hard palate, roof of the mouth, B. The sacral area over the lower back, C. The shin just below the knee, or D. Fingernail beds, and should choose A. The hard palate. In dark-skinned infants, mucous membranes such as the hard palate provide a more reliable indication of bilirubin deposition than skin tones, which can mask yellowing. Why A is correct. Thin mucosa of the hard palate reveals bilirubin staining earliest. Why B, C, and D are incorrect. Skin and nail bed assessments may miss subtle jaundice in deeply pigmented skin. The mucous membrane inspection is most sensitive. Question 65. Continuing on, before your transurethral resection of the prostate, you should expect 4 possible post-operative management steps. A. Removal of the entire prostate gland. B. Placement of a nasogastric tube after surgery. C. Completion of a bowel cleansing regimen the night before. Or D. Leaving an indwelling urinary catheter in place following the procedure. And the correct answer is D. Leaving an indwelling urinary catheter in place. A TURP removes only the enlarged central portion of the prostate to relieve obstruction, and a large lumen Foley catheter, with continuous bladder irrigation for the first 24 hours, prevents clot formation and maintains drainage. Total prostate removal is a radical prostatectomy, option A. Gastrointestinal tubes are unnecessary for this endoscopic urologic surgery, option B. And no bowel prep is required as in colorectal procedures, option C. Before tackling the next scenario, here's an opportunity you don't want to miss. Over 100,000 nurses have already conquered the NCLEX with our complete crash course. We're giving you a free 5-day trial featuring live and recorded instruction, NGN case studies, 5,000 exam-style questions, plus 1-week and 1-month study blueprints and expert PDF notes. It's as easy as clicking the WhatsApp link in the description and messaging "Hi" to enroll immediately. Thousands are already seizing this advantage. Will you? Let's continue with the next question. Question 66. Additionally, when caring for a Hindu client at end of life, consider 4 post-mortem practices. A. Opting for cremation soon after death. B. Assigning a family member to remain with the body continuously. C. Refusing organ donation under any circumstances. Or D. Performing Catholic last rites at the bedside. And the practice aligning with Hindu beliefs is A. Opting for cremation soon after death. Hindu tradition views the body as a temporary vessel for the soul, and same-day cremation facilitates the soul's liberation, moksha. Standing watch, option B, is a Jewish custom. Organ donation, option C, is generally permitted and charitable in Hinduism, and Catholic last rites, option D, pertain only to Christian faith. Question 67. Moreover, in suspected carbon monoxide poisoning, the nurse must choose the appropriate oxygen delivery device among A. Nasal cannula, B. Venturi mask, C. Simple face mask, or D. Non-rebreather mask. And the correct choice is D. Non-rebreather mask. Carbon monoxide binds hemoglobin with far greater affinity than oxygen, so near 100% FiO2 is required to competitively displace CO, and only a correctly fitted non-rebreather with reservoir bag and one-way valves delivers that concentration. A nasal cannula provides up to roughly 44% FiO2, option A. Venturi masks titrate moderate levels, option B. And simple face masks deliver 40 to 60% FiO2, option C. All insufficient for CO elimination. Question 68. Following that, when initiating a 24-hour urine collection at 8 a.m., the client's first void at that start time must be managed by one of these actions. A. Save it in a separate container and add it later. B. Discard it and record the start time. C. Discard it and only collect for the next 12 hours. Or D. Keep it and include it in the 24-hour total. And the correct action is B. Discard it and record the start time. The initial void represents residual bladder urine outside the time period. Discarding it and noting 8 a.m. as the collection start ensures that all subsequent voids accurately reflect a true 24-hour output. Question 69. Subsequently, when report is given on 4 clients, the nurse must assess one first. A. A COPD client using pursed lip breathing with a productive cough. B. a post-operative laparoscopic cholecystectomy patient complaining of right shoulder pain and abdominal cramping? C. An ulcerative colitis client who has had 3 bloody stools in 2 hours with cramping? Or D. A client 2 hours post-tonsillectomy who is vomiting and complaining of throat pain? And the priority is D. The post-tonsillectomy client with emesis and throat pain. Forceful vomiting or coughing can disrupt the tonsillar bed and precipitate life-threatening hemorrhage. Immediate assessment for bleeding, antiemetic administration, and gentle throat support are essential. Shoulder pain after laparoscopy. Option B is common from residual CO2, COPD cough. Option A is expected. And bloody stools with colitis, option C, are characteristic of the flare, none posing an immediate airway or bleeding threat. Question 70. Finally, a client instructed to collect urine for a 24-hour protein and creatinine clearance test must follow one of these directives. A. Discard the morning's second void and then begin timing. B. Throw away both the initial and final urinations. C. Discard only the very first void at the start time. Or D. Save every urine specimen, including the first one. And the correct directive is C. Discard only the very first void at the start time. Flushing residual urine at the designated start establishes a true 0 point. Thereafter, every void, up to and including the final one at the end time, must be saved to ensure accurate measurement of volume and analyte concentrations. Question 71. To begin, advanced care planning often involves designating a medical power of attorney. Among these actions, A. Naming someone to handle your bank accounts and bills. B. Outlining funeral preferences and memorial arrangements. C. Authorizing a chosen agent to make medical decisions if you cannot. Or D. Selecting your primary care physician. The legal document specifically empowers. C. Authorizing a chosen agent to make medical decisions on your behalf. A medical POA, healthcare proxy, ensures that when you lack decision-making capacity, your values guide treatment choices, such as consenting to or refusing blood transfusions or life support, whereas financial matters, option A, funeral directives, option B, and physician selection, option D, are covered by other documents or processes. Question 72. Next, when planning a new group therapy session on the mental health unit, you must choose the client best suited to benefit. The options are A. A client in an acute schizophrenic psychotic episode. B. A client with bipolar I disorder currently in a mixed manic-depressive state. C. A client with post-traumatic stress disorder struggling with nighttime flashbacks and insomnia. Or D. A client undergoing delirium tremens from alcohol withdrawal. The ideal participant is C. The PTSD client, because group therapy requires sufficient cognitive clarity and emotional stability to engage with peers. Sharing coping strategies and learning grounding exercises in a supportive setting helps normalize trauma responses. Clients in acute psychosis, option A, mixed episodes, option B, or delirium tremens, option D, lack the stability necessary for meaningful group interaction. Question 73. Furthermore, a 45-year-old client on telemetry requests coffee after waking. When educating about caffeine's cardiac effects, consider these responses. A. Hot drinks are contraindicated for anyone with heart issues. B. Your physician's diet order prohibits coffee. Please choose another beverage. C. We no longer stock coffee. Would you like herbal tea? Or D. Coffee contains caffeine, which can trigger arrhythmias, so it's best to avoid it right now. The most informative choice is D, because it explains that caffeine is a stimulant that can increase heart rate and provoke dysrhythmias, empowering the client to understand and adhere to the restriction. Statements that overgeneralize, option A, merely cite policy, option B, or suggest alternatives without rationale, option C, fail to educate about caffeine-specific cardiac risks. Question 74. Moreover, a child admitted with classic measles, rubeola, requires strict infection control precautions. The options include A. Contact precautions with gown and gloves, B. Droplet precautions with surgical mask, C. Airborne precautions with N95 respirator, or D. No isolation, standard precautions only. Because measles remain suspended in air for up to 2 hours after an infected person leaves, the correct measure is C. Airborne precautions with a negative pressure room and N95 respirator. Contact precautions, option A, and surgical masks, option B, do not protect against lingering aerosolized virus. and standard precautions alone, option D, are insufficient. Let us finish this series with last question. Question number 75. A newly hired nurse administers medications via a double-lumen Salem sump NG tube. Which practice warrants correction? A. Flushing the blue air vent, pigtail, with water before giving meds. B. Requesting liquid formulations from pharmacy when available. C. Rinsing the main lumen with water between each drug. Or D. Delivering each medication separately through the tube. The action that must be corrected is A. Flushing the air vent, because that port is designed to admit atmospheric air and prevent excessive suction pressure. Introducing water risks clogging it and causing mucosal injury. In contrast, requesting liquid meds, option B, flushing the main lumen between drugs, option C, and administering each medication separately, option D, all adhere to best practices and prevent tube occlusion. Thanks for watching. Pick up you all in next video.